The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. It's Tuesday, and we are gathered here for the next episode of TMD Demystified. I am Tony Urbanek. Today's title and today's topic is the patient's fix me mentality in TMD. The patient's fix me mentality and how it applies to TMD. Now, if you have been a practitioner for any length of time in any of the health provider services, I assume I'm speaking mostly to dentists or almost exclusively to dentists, oral surgeons, orthodontists, general dentists. You're familiar, at least with the idea. The patients may not say it, although I've had several people in my career address me about their problem and just say, fix me. Give me the symptoms or the complaint, their chief complaint. Why are you here? I want to be fixed. Fix me. That is the mentality of, I would assume, and my opinion is, most patients who seek healthcare services show up one way or another with the expectation that they've already done their job. They showed up. I'm here, fix me. Now, let's break that down and talk about that a little bit, because we're going to talk about it as it applies to TMD. That is the constant topic of this podcast, TMD Demystified. And if you are going to treat TMD patients, you not only need to know the technical aspects, clinical aspects of using a very simple intraoral device that unloads the joint, decreases inflammation, and eliminates all of the usual and customary TMD symptoms. But you also have to know how to deal with and handle the patients that belong to that diagnosis we euphemistically call TMJ. And that's what we're going to talk about a little bit today. It's not complicated. I want to make a few points, but I think if you'll bear with me, you'll see the truth in it. It's an inconvenient truth. It's inconvenient truth. It's inconvenient for the doctors, actually, who it's inconvenient for, because as a doctor, we're trained to handle disease. And sometimes we're trained to handle preventing disease, which is a better thing to do than actually handling the disease itself if we can prevent it. But our responsibility, it also includes handling the patient that is connected to that disease process. In other words, they have a body and they have a mind, and quite often the two don't match as far as the purpose of the body or the mind. And they sometimes go in different directions. Body wants to do one thing, mind wants to do another. I think everyone can agree that at times in your life that has happened under various kinds of circumstances. So again, to say it the same thing in a different way, you're responsible, if you want to treat this patient successfully and easily and without a lot of hyperbole and complication, you also need to be aware of and be able to handle the mental aspect that the patient brings along with their requirement to alleviate their symptoms. And so that's why I entitled this, The Patient's Fix Me Mentality in TMD. So first of all, let's just talk generalities about the fix me mentality, and then we're going to talk a little bit about how it applies to TMD. So patients will arrive at a healthcare provider. In this case, let's just limit it to dentists, dental specialists. And there are really two types. There's a patient type 1 who comes into the office, and sometimes rightfully so, and says, fix me, or thinks in his mind, fix me. And that might be a patient who just broke a tooth, or a patient who has dental pain, or in the medical community, it might be, something that arrives in the emergency department, some kind of trauma or diagnosed cancer, and they are well justified by just showing up and expecting the provider or the provider and his team to go through all of the gyrations and preparations to provide the service to fix that particular problem, either rapidly or over a long period of time. That same thing certainly applies to dentistry. If a patient, as I said, comes in with a broken tooth, or they have an infected, impacted wisdom tooth, they're justified to show up and describe their symptoms, swollen face, X-ray that shows an impacted wisdom tooth, and say, fix me, because they are not qualified. They have absolutely no knowledge of the steps necessary to go through and create a solution for those particular dental problems. Or in the case of medical disease, our medical colleagues primarily use pills most of the time. And that's really where this concept generates from. They show up at the PCP office, and the PCP may or may not get some preliminary lab work, but takes a history and finds out what the chief complaint and associated complaints are, and explains to the patient what the disease is and the disease process, and then hands out a pill or set of pills. And the patient expects that to fix them. And I think that's where the whole concept of fix me originates from. Fix me type 1, no responsibility. Fortunately, there are patients who acknowledge that to get fixed, they have to take some responsibility in the process. So when the patient takes responsibility, type 2, there are two types of responsibility. They have to, first of all, learn about the disease itself. And a lot of people nowadays with the internet, fortunately so, sometimes it's overly done, is get on the internet and learn all about a disease, but really not understand the nuances or all the specifics. And that kind of complicates the consultation sometimes. I've been there and done that multiple times. Patient coming in with too much information about TMD. On the other hand, I'm not talking about those patients. I'm talking about patients who take a reasonable amount of time to learn about the disease, either from science journals or particularly from the doctor himself, and take the time to learn about the disease and take the responsibility to learn the pathophysiology of disease up to the level that they can understand. That's A. And then B, follow along with the doctor as he explains how whatever treatment he is going to be using, how that is going to work, be it pill, pharmaceutical, or surgical correction, or some other kind of treatment, non-surgical treatment that might be cranked into the solution. So there's type A, learning like what's really going on with this disease in terms that they can understand, the pathophysiology of it in terms that they can understand, and also in terms that they can understand how your particular recommended resolution is going to fix that. So that is type 2, please fix me patient. All right, so that's the general nature of it. It applies to all healing areas, healing healthcare providers, whether you're a chiropractor, a dentist, an oral surgeon, a heart surgeon, PCP, physical therapist, for physical therapist or physician's assistant in a convenient care clinic. We see these patients, and I'm trying to describe it for you so you can get a organized vision of really the types that you will be dealing with. And then in our case, for TMD Demystified, we're just going to rather rapidly break it down to how that applies to the TMD patient. So I've seen both type 1 and type 2 coming into the office. And if you'll think about a little bit in your case, in your examples, in your practice of general dentistry, oral surgery, orthodontics, you've also seen both type 1 and type 2. Type 1 may be justified. There may be a justification, and I would not disagree that that is sometimes justified, that they are a type 1, but not with TMD. Someone who comes in with TMD and just says, fix me, does not have the proper expectations, and they will not end up usually being as successful as most other patients, because the patient has a large part to play in the success of treating TMD. Again, for those that are not experienced with treating TMD, and probably many of you are not, many of you want to avoid treating TMD completely. And that's one of the purposes of this podcast, and particularly this episode, is to take away all of the justifications why you should treat TMD, because treating TMD is actually very simple when you understand the technology, when you understand the clinical process, and when you're satisfied and comfortable treating the patients themselves. I have been told, and I mentioned so many times on other podcast episodes, how I have been throttled with my colleagues telling me, like, why do I want to treat TMD, so many TMD patients? Because they think they're crazy. They think they're a big problem. They think they're a never-ending problem that never goes away if you take on a patient with TMD. That is absolutely incorrect, not true. Actually, if you know how to treat a TMD patient properly, the biggest problem is you can't get them back to your office once you make the symptoms go away. They don't want to take any more of their time. They're satisfied. They're happy. They don't want to come back for any more follow-up appointments. And frankly, in our private practice, and I find the same thing from our network providers who use our device and protocol, they agree. One of the biggest problems, they can't get the patient back. They can't get them back for follow-up once they send them out with the device and instructions on use. So when it comes to treating TMD, the patient who comes in with type 1 attitude, mental attitude, it's a mental attitude, fix me, is not going to make a good TMD patient. And one way or another, you have to overcome that mental attitude. I suggest overcoming it very overtly, to confront it, not aggressively, but to confront it and to begin right from the beginning at one point or another in your consultation pattern. And you can do it many different ways, many different places along the way, as you explain what you need to explain, that the reason you are going through explanations and you're going through communication is to explain things to patients so they can take and accept their level of responsibility in treating their own TMD symptoms, their own TMD diagnosis, their own TMD process. So TMD does not avail itself at all to the patient who walks in and just throws up their hands and say, I'm here, I got all these problems, fix me. If you have a patient that expresses that directly or indirectly, overtly, or inferentially, I guess would be the follow-up opposite of that. They infer that without words. I would suggest one way or another, you get rid of that patient as easily and as rapidly as possible, because they're not going to do well under your care if you follow what we teach, what I know, the clinical process, the follow-up process, what's expected to happen. And we can predict, I mean, I predict all the time to the patient exactly what's going to happen if they'll follow the protocol. They'll use the device as instructed and follow the protocol and follow the follow-up appointments, either directly in person, or now we offer to some patients, especially those who come in from a distance, longer than an hour away, we automatically offer virtual follow-ups. But a follow-up is a follow-up, so we can document and make sure the patient is gaining the benefits that we have to offer. And then everybody's happy. The doctor's happy that he has it documented, and he's happy that he knows what he's done has been successful. The patient is, of course, happy because their symptoms go away. But type 2 and patient kind of B, who actually follows the directions, is compliant and also listens to the pathophysiology that should be explained to the patient. There are two things when it comes to educating a patient about TMD, and every patient that comes into your practice for the treatment of TMD, number one, should not be accepted if they really are a just treat me, fix me kind of patient. They have to take responsibility. But once you cross that bridge and you made it clear that it is expected that the patient takes certain responsibilities, then there are two parts to that responsibility, part A and part B. Part A is to educate the patient as to what actually the disease process is. Now, that is where the dental establishment, the dental schools, the dental universities, and 99 and 44, 100% of the dentists are falling short tremendously because they don't know what we have discovered about the pathophysiology of TMD. And I'll explain it again for the 100th time, probably not exaggerating that, the 100th time. All of the symptoms, all of the disparate symptoms of TMD are driven directly from, caused by chronic inflammation within the temporomandibular joint. Anatomically, physiologically, neurologically, if you have inflamed joint, then it creates a pathophysiologic response to the muscles to tighten up, not move that particular joint, whether it be a knee, a hip, an elbow, or a temporomandibular joint, which then creates the muscles to get tight. They pull on the bone, stimulates the nociceptors in the periosteum, and creates all kind of facial pains everywhere and everywhere in all areas of the face, and then developing into the neck, and then developing into the upper shoulder girdle. So in any case, that's the pathophysiology, but the patient needs to, in their own terms, in words that they can understand, they need to be schooled. They need to be educated as to really what's going on. Why? Just generally speaking, because they will make better patients. They will much more easily accept treatment, and you want them to get better. You want them to accept treatment for their benefit, for your benefit, for the benefit of the practice. You want them to accept treatment. So you have to start out educating the patient as to really what's going on with this disease. And if you'd like, we have one of the prior episodes specifically shows an ideal consultation and the pattern, the protocol that goes in with teaching a patient. One of the earlier episodes in this series on TMD Demystified. You can look it up. Once you get through the educational part, that's part A of having the patient get enough information that they can take responsibility. Then you go into part B as to how the device itself works, what the device itself does to alleviate the chronic inflammation within the temporomandibular joint, so that they understand that when they put this tool in their mouth, according to a protocol that has been worked out very carefully to provide maximum benefit and maximum relief of the chronic inflammation within the temporomandibular joint or joints, then the patient will understand how the treatment will work. And when they understand how the disease itself works, or let's say doesn't work, creates the symptoms themselves, and then how device and protocol work together to make the symptoms go away by decreasing chronic inflammation. Then the patient has enough information to satisfy Part A and Part B, and they make wonderful patients, and they're extremely compliant, and they go through the protocol with ease. Not to say that you don't run into the common problem of once they're happy with their level of symptom relief, you can't get them back to the office. And I understand that. I'm not necessarily criticizing patients for that, but it's not the ideal scene, because we would like to fully and completely finish our documentation for that particular patient and be able to document exactly what percentage of the original symptoms are diminished, decreased, or gone. But we know that when we can't get a patient back in, we call them up, the person in reservation in reception calls them multiple times to make an appointment. And usually if they get a hold of them at all, it's like, no, I'm fine. I'm good. I don't need to come back. I'm happy for them, but it leaves us a little cold. And we deal with that as best we can. So that is why the Fix Me patient, as it applies to dentistry in a general way, all healthcare providers in a general way, needs to be very specific and specified as applies to TMD. You are not interested in treating the patient who comes in and just says, fix me, I got no skin in this game. I'll come, I'll sit here, but just do what you got to do. I don't need to know about it. I don't need to read about it. I don't need to think about it. Just fix me. Have those patients leave your practice one way or another. Be honest with them. Honesty is the best policy. That's what Mom said. And be honest with them. That's the best policy. Just be honest with them why that you think that they're not a good fit for your practice. That will usually take care of the problem one way or another. They'll either go, yeah, I'm in the wrong place, or they'll wise up and say, yeah, that's not realistic for me to say I got nothing to do with this. I have to take some level of responsibility. What's their level of responsibility? To listen and learn from the doctor how the pathophysiology of TMD works, what that is all about, chronic inflammation and all that explanation, and then be able to understand why the device and protocol work together hand in hand, why it works to make the chronic inflammation go away, diminish the symptoms. All right, I'm satisfied that I got my point across in a rather cogent way. Hope it was cogent. Hope it is meaningful. If you are a newbie, and this is your first time listening to TMD Demystified, I will say for the newbies, if you would like to become a network provider and learn how to use this device and protocol, which is patented, FDA cleared, independent universities studied and approved, showing our success rates, validating our success rates is in the 90% if the patient will follow the protocol and use the device as directed. It's a tool. It's a tool. So if they will do that, you will have excellent responses. You will have a service you can offer to your patient that is not encumbered by insurance qualifications and control. You have a procedure that is easy to do. You'll invest no more than 45 minutes of your time totally to treat a TMD patient from start to finish. On average, some people a little less, some people a little more. There are nuances that is taught in our course. To be a member of our network provider group, you have to take an online course or come to Nashville and do one of our seminars, at which then you are qualified to be licensed because it's patented. Once you are licensed, then you can order the device and become a member of our team. And we include all of our network providers as team members. We're there to help you. We're there to educate you. We're there to answer your questions from now forward. So it's a great opportunity for you to expand your practice in the treatment of TMD. With that being said, I look forward to our next episode, which will occur on a Tuesday. and I will pick out a topic hopefully that will be meaningful and help you understanding one way or another all of the issues and all of the nuances of treating patients with TMD. Until then, I look forward to our next discussion. I am Tony Urbanek, and this is TMD Demystified.